Thrombosis, defined as the formation of a blood clot within a blood vessel, is ubiquitous in medicine and society. It can either be protective, stemming blood loss following an injury, or harmful, even life-threatening, when developing without good cause. Thrombosis that occurs within an artery is the proximate cause of heart attacks and strokes, affecting 750,000 and 1 million persons, respectively, each year in the United States. Blood clots within the veins cause deep vein thrombosis, also known as venous thromboembolism, or VTE, and pulmonary embolism, with up to 600,000 cases yearly and a 30% case fatality rate if untreated. Thrombosis, whether occurring in an artery or a vein, is often preventable and treatable with medications delivered orally, subcutaneously, intravenously, or locally using specialized catheters that can also be employed to physically remove the blood clot and restore blood and oxygen supply to vital organs, including the heart and brain. October 13th, 2015 has been designated as World Thrombosis Day, a worldwide initiative aimed at reducing the significant disease burden caused by thrombosis. The overall goal is to raise much-needed awareness and action through public and professional activities. The date was chosen in honor of the birth of Rudolf Virchow, a German physician and scientist credited with first describing thrombosis and the conditions that underlie its occurrence. The University of Cincinnati College of Medicine and its faculty and staff within the Heart, Lung, and Vascular Institute are intimately involved with the investigation, prevention, diagnosis, and treatment of arterial and venous thrombosis across a broad spectrum, including heritable and acquired conditions, both common and rare. The groundbreaking and innovative work being performed right here, right now, is our pledge to the people of Cincinnati, the region, and across the country to provide the best possible care. Today I have a special guest with me, Judy Kleinman. Judy understands firsthand some of the challenges that one can face with thrombosis. In this particular case, a pulmonary embolism, which is a blood clot to the lung. And we'll spend a little bit of time talking about some of the signs and symptoms and things that we can do to help the public recognize something that is life-altering or life-threatening. Judy, welcome.
Thank you. It's good to be here.
And thank you so much.
Thank you.
It's really our pleasure. And we're going to talk a little bit about you.
Okay.
And some of the symptoms that you experienced around the time that you had your blood clot, the pulmonary embolism.
All right.
Can you tell us a little bit about that?
Well, thinking back, I remember having real trouble with shortness of breath. And I was a heavy smoker, and I was relating that with a cold and, you know, getting winded just going up the steps. I mean, I knew down inside something wasn't, you know, that just didn't seem normal, but I, you know, maybe would have say I was brushing it off a little bit.
Yes.
And, you know, telling myself, boy, you need to quit smoking. So, but I really wasn't obsessed or concerned about it because I was having so much trouble with a bad hip.
I see.
And that's when I went into the ER because of the hip. And they said, well, your oxygen level is awfully low. And they did a chest x-ray, and that's when we discovered that I had a blood clot in my right lung.
Yes. And as you look back, even though you have smoked in the past, and perhaps you had some shortness of breath or cough from time to time, would you say, yes, there was something that was different this time?
There was something that was different, definitely, definitely.
And you subsequently had the diagnosis, and you were started on treatment.
Yes, yeah, I was actually admitted from the ER into the hospital and put on heparin, and spent about 3 days in the hospital till we got that INR down to where it needed to be. So.
Yes. So you were on medication. Sometimes we use intravenous blood thinning medicines. Sometimes we use what they're called are anticoagulants or blood thinning medicines under the skin, and then we transition that to a pill.
Yeah, I transitioned from heparin to Lovenox, which I think the Lovenox was going to be the bridge
That's right.
to the warfarin taking effect. So I had about 3 or 4 days, I think, of the Lovenox, and then.
And when did you start to feel better, where you could then reflect and say, I guess this wasn't from my smoking, that it was this blood clot?
I would say probably within a couple of weeks I started feeling better in that sense. Also because I was going to be getting some help with that bad hip.
Yes.
That was really, you know, my main concern and the chronic problem that I was having.
Yes.
So I was feeling pretty good, and my primary doctor said, well, we're going to do about a 6-month regimen of the warfarin, and then we're going to try to get you weaned off, because for your hip surgery, you probably shouldn't be on the blood thinners. So,
Yes.
you know, it might not be a good mix. So.
Yes. I'm going to give you some statistics just to see what you think. Each year there are about 10 million blood clots. They're deep vein thrombosis, also known as DVT, and pulmonary embolism. Does that surprise you that there are that many?
I guess it does. Yeah, it does.
And did you know anything about having blood clots in the legs or the lungs prior to that?
Well, working for a podiatrist, you do become aware of vascular issues. A lot of our patients are elderly, and they have circulatory issues and vascular issues, chronic ulcers that won't heal due to diabetes a lot of times, but also, as I've learned, just to the circulatory issues. So I was somewhat aware of it, but again, I'm thinking it's people that have other issues going on, the diabetes, the elderly that, you know, aren't walking and moving about as much. So I didn't really think too much about it being a problem with somebody my age, I guess.
Well, that's really telling for me as a physician. You're an informed person. You're working in a medical profession. And here's something as common as 10 million cases a year, 600,000 plus in the United States. And you have a little bit of knowledge about it, but I suspect, and you can correct me if I'm wrong, not as much knowledge as you would have about a heart attack or a stroke. Is that fair to say?
That's fair to say, yes. That's fair to say.
And again, turning to statistics, it is telling. So if you do a survey of 100 people, about 70 to 80% of those individuals will have heard about a stroke or a heart attack, including the warning signs.
Right.
Chest discomfort that goes into the arms, or numbness or tingling or loss of strength in a hand or a leg for heart attack and stroke respectively. But about 4 out of 10, or 40%, will have even heard of deep vein thrombosis or pulmonary embolism. So it sounds like we have a little bit of work to do.
I would think so, yeah.
In terms of making people aware. And what do you think would be a good way to make people aware? Obviously, you and I are talking for a reason, and that is to raise awareness. But for you, what would help out in the community to kind of get that message across as we have for stroke and heart attack?
I mean, I guess there are different reasons why you have a DVT. I think mine is basically the lupus anticoagulus that I've been diagnosed with, or have the marker in my blood for. But I don't really know what's the best way to make people informed about it. I guess it can happen to people of all ages, even maybe younger people.
It can, and it's one of those things that can be seen in youth. There could be genetic predisposing factors, and it does increase with age. A majority of the blood clots in the legs, deep vein thrombosis that cause pain, redness, and swelling in a calf and sometimes in the thigh, occur in people that have been laid up for a period of time. It could be that they're they're hospitalized.
Yeah.
And they're in the hospital for a good reason. They may have had an operation, they may have a medical illness, they may have been in a motor vehicle accident. So those are some of the predisposing factors.
Well, and when I first presented to Dr. Sanford after I had been in the hospital from the blood clot, you know, I had that bad hip, and we wondered if, I mean, it was really taking me out of a normal life.
Yes.
And I was doing what I had to do every day at work, but then going home and pretty much parking it.
Yes.
Because everything was hard to function. And I wondered and suggested maybe, did I have some atrophy in that leg that maybe caused that? And there was, you know, question, maybe it did happen because of that. But
and no question that period of inactivity is one of the predisposing factors. And part of that is that the circulation, particularly in the veins, is highly dependent on muscle contraction. Every time the muscles in the legs are used, it actually physically contracts the veins, and that pushes blood.
okay.
And without that activity, there's a stagnation of some of the blood in the legs. And if somebody is predisposed, as you were predisposed, that's when the blood clot can develop. Now, as far as pulmonary embolism, you had some shortness of breath.
Shortness of breath, yeah.
Yes.
I mean, I would walk up the stairs, and you know, top of the stairs, I would be out of breath. And
yes.
yeah, it was scary. But you know, I was probably in some kind of sense of denial about it. You know, I just really thought, oh, I had a cold, and you know.
Sure.
And it did seem to kind of be worse at times and then ease up. So, and it might have been just the amount of exertion I was, you know, going through. But
well, there's no doubt that people in general, we're very good about adapting and working around things that might be a limitation to us.
right.
But for some of our viewers, some of the signs and symptoms of pulmonary embolism are a sudden onset of shortness of breath, chest discomfort that is worse when someone takes in a deep breath. And about 15% of people that have a pulmonary embolism feel dizzy or lightheaded, or they actually might pass out.
It's because of the lack of good oxygen.
It's lack of oxygen, and it's a lack of blood that's being pumped from the right side of the heart to the left side of the heart. So the message that we want to get across to those that are watching us right now would be, for blood clots in the legs, it would be pain, redness, or swelling. For a blood clot in the lungs, it would be shortness of breath, pain upon taking a deep breath, or occasionally feeling dizzy or passing out.
Yeah. One of the things I remember dealing with at work when I would file, and I'd reach up over with my right hand, I felt pressure in the chest then. And you know, I didn't know what was causing it, but now we know. But
aches and pains are so common, and you're right. Someone might not think of it. You will think about it because you've experienced it, and that's exactly what we want for the community, is just to be aware. In terms of how we'll make the community aware, it'll be a multi-pronged approach of discussions like ours. There'll be printed material, billboards, coverage on radio or
getting different
TV,
stories out, and
just letting people know that this is not rare. Certainly not with 10 million cases per year on a global basis, and about 750,000 or more in the United States alone. It's not a rarity.
Right.
I'm sure people are wondering how you're feeling now. How do you feel?
Good. Back to full schedule, doing gardening, and you know, living the dream.
You're doing everything that you would want to do, and that's what it's all about. So I want to thank you for joining us today on our Scholarvision. You had said to me that, yes, I'm happy to do anything that would help someone.
Yes.
And I can assure you that the discussion that you and I have had today is going to help somebody.
I hope so.
It's going to make a difference.
Don't wait if you have that onset of shortness of breath. I mean, I did, and I'm lucky, I guess, that it didn't go worse. But
Well, and that is the best way that I can think of to conclude our discussion, is with some words of wisdom. Thank you for joining us today for this special segment that is dedicated to World Thrombosis Day. We've heard about thrombosis and the impact that it can have on a person who has experienced it. It's our hope that the discussion and the words that we've shared today will make the community more aware, and they will seek medical attention. Until next time, keep asking questions. Inquiry is the true compass of scientific advance and medical progress.